Everyone. There you go. I love that new.
There we go. Awesome. I'll do a quick formal intro because that's how it should go, right? You know, you are the superstar, so I'm going to make you look like the superstar that you are. Welcome everybody to the Breath, the Secret of Dramatically Improving Posture, Movement, and Performance. I am really honored to be able to introduce our speaker today, Jenice Mattek. It would be a little bit hard pressed if there's anybody here today who has not heard you speak. And if they haven't, or read one of your books or attended one of your certification sessions, if you haven't, you are in for a treat. If you have, you know you're going to get a ton out of this session. One of my favorite things about listening to Jenice, who has just incredible experience, both teaching with fitness professionals and wellness professionals, but also with patients and clients herself, is her ability to take something that seems so complicated and complex and make it tangible. And you will walk away with something exciting, some amazing knowledge. So with that, Jenice, I'll turn it over to you. If you have questions, everybody post them in the chat. We'll have time at the end to do some Q&A, and we will we'll touch base at the end. Jenice, thank you for being here. Enjoy, everybody.
Awesome. Thank you so much, everyone, for joining my session. It is a beautiful Saturday afternoon here in the Midwest. We've been so blessed so far this month to have just the most beautiful days. And I know we're all sitting inside, so I do appreciate you taking the time out of what is now summertime for most of us here and joining me for this really important session. Several years ago, I was sitting with my business coach and he said, you need to give away the number one thing that you do. And so today I'm going to give away the number one thing that I do, and that is help people breathe better. And I love this quote. I actually wish I knew who said it, but change your breathing, change your life. And I feel like in the industry, in many industries, breathing has become almost a fad. Everybody's now teaching breathing or a version of breathing. But if we really look back historically, breathing and working on breathing and being mindful of how we breathe is from ancient times. And it's just, I'm excited that it has made this revival. And I'm going to explain to you this approach to breathing for you as fitness professionals. So I own with Dr. Evan Osar, the Integrative Movement Institute. We are located in Chicago, Illinois, where we see our clients at our practice called Chicago Integrative Movement Specialists. And there is where we also teach health and fitness professionals just like you how to integrate things like assessment, breath, posture, and movement. So with that, let's go ahead and get started. I'm going to share this client story with you because you might recognize the face. If you've been around the FAI family for any period of time, you've seen this sweet face at the live events. And she became a client of mine at the end of last year. She reached out and became a client of mine because she literally...
Can I just jump in real quickly?
Yep.
I think we might be not seeing your same screen.
Okay.
Did you flip over?
I did. Let me try again. Thank you, Lindsay, for letting me know.
Yeah, sure. I wanted to see the sweet face.
Right. Did it come up? Not her face yet, but this is gonna be a video.
Yeah, okay, it should be good.
Let me know the video starts.
It's not full screen. Is it okay that you have it?
No, it's not full screen. Nope.
Good. Okay, perfect. Then you're all set.
Okay.
I for sure didn't expect to get taller. Nor did I expect to see such an amazing, I didn't expect to see the pictures, the amazing difference between beginning and end.
All right, Jenice, I'm back.
Uh-oh, what's wrong?
It's not showing. You might need to either hit presenter view, or we're not seeing the video. It's just the black box. Or is it in another screen?
So in the full screen view, you're not seeing it.
Yeah, we're not seeing it in full screen view. Play from start. Will it pop up that way?
Well, that's where it just was. We'll try again. Sorry, guys.
Yeah. Nothing like a fun technical issue. It's okay.
Yeah, just worked last night for another group. This is stinky. Okay. All right, let me see. Can you see this black box?
We see the black box. We can hear it, but it's not going into full screen. We still see your like your PowerPoint view.
Okay, hold on.
Yeah. Everybody just take a breath properly. Nothing like a good breathing joke, you know?
All right, let me try this once.
Now we're in full screen. Okay, now we can see the video. Okay, we're good.
I
Great.
for sure didn't expect to get taller. Nor did I expect to see such an amazing, I didn't expect to see the pictures, the amazing difference between beginning and end. And I did not expect that it would have enough, that the practice would have enough of an effect on regularly when I'm sitting here, and how I think about the effect it would have on my day-to-day office. Therefore, I just don't get as tired or sleepy. I don't lose focus as much when I'm sitting here working on a project, because I'm sitting differently and breathing differently. I guess breathing differently, therefore sitting differently. Therefore, I mean, you know, it's just interesting how it just little by little creates a totally different experience. Yeah, it takes a while. There's no doubt. It isn't something that comes rapidly to make it normal, because I've had 15 years of learning how to do things a different way. Yep. And that's a lot of baggage to carry with you, you know?
Well, Marcia, we started working together, I think it was December 29th was our first session.
Yeah, I remember, because I was thinking, this part of it was, this pandemic is, the truth, part of it was, I hated my posture. And I knew that my posture was compromising my breathing. I knew that that would be true.
Okay, Lindsay, can you just give me just a quick yes? You can see the next slide.
All set, looks good.
Perfect. Awesome. So you guys, the interesting thing was, I had asked Marcia a few weeks before this if she wouldn't mind giving me a testimonial, just because she was so excited about the changes that she saw in her body. And she said, oh my goodness, in the session that we just recorded, she's like, oh my goodness, I forgot to do that. I will go ahead and do that. I'm going to write it down in my book. And then she just started talking. This was a completely organic conversation. And there's probably about 15 more minutes of her sharing her experience with this work. And I just said to her at the end, Marcia, this was just this really easy conversation. I don't think you felt forced. You're just literally sharing with me your experience. Can I use this as a testimonial? So this is a Marcia approved testimonial. The interesting thing was, after she watched what I was going to put together, she said to me, Jenice, we might need to redo it, because I don't know where I came up with 15 years of baggage. I'm 72. I have 72 years of baggage that I had to work with to start to make these changes. So Marcia is so young at heart. And she also said, I also took out all the quirkiness that she does with her facial expressions, which are to die for, and it makes her uniquely her. So I want to thank Marcia for that. I want to thank Marcia for being open as another fitness professional to work with another fitness professional to start to make changes in their own body. And she was a great example of it. She did the work every single day, and she got to have these magnificent changes. Other things that changed for Marcia that are later in the video, where her acid reflux, she no longer has acid reflux. She's able to get off her acid reflux medication. Another thing she said to me was, I don't know if it's related, but my asthma and allergies have not been as bad this year. And that's another common thing client will tell us once they start to put these breathing practices into place in their everyday life, is things like asthma and allergies start to change, how it affects their body. So the goals of today's session are to identify the factors that are making your client's life a little bit harder and what's not allowing them to breathe optimally. I want you to feel like you can leave this session and begin to implement some of this three-dimensional breathing into the programs you're already doing with your clients. And hopefully you'll find that it enhances the programs, enhances your client's life. And then finally, I want you to confidently demonstrate to your clients how this three-dimensional breathing is changing their body. So really quickly, just the benefits, the overall benefits of breathing and breathing well is oxygenation. We all know this one. It's the idea that everything, the body, the breath, we need that to transfer down into that cellular level. We need oxygen to get down to that cellular level, to get into our organs, to get to our brain for just overall systemic health. It actually starts to improve the actual energy that we're able to put out because we just do things more efficiently. Our systems are working more efficiently, giving us more energy. It's that sense of relaxation. It also can have the exact opposite state of relaxation, depending on how we use our breath. Because remember, breath is unconscious, but we can consciously control it. And so if we're using our breath in a slow, mindful manner, it can start to create that idea of relaxation. If we are using it in a different manner, it can actually elicit more of that fight or flight response. So we are able to consciously control our breath in that way. For us today, we're going to look more at the mobility and the stability benefit of breathing. When we breathe well, we will actually start to change the range of motion and the mobility we have available to us. We'll also, through our breath and understanding the diaphragm and its other connections into the rest of our body, can start to incorporate joint stability by using breath in our exercise programs. And you're going to start to see what that looks like. Now, what does it look like when your client doesn't breathe well? And these are common postures you likely see as your clients start to age and depending on how active they were before they came to see you. You're going to see that big barrel chest. You're going to see those wide open and splayed rib cages. You're going to see that forward head posture where your client just starts to bring that head forward. Maybe they start to get a little bit of that dowager's hump. I've had a couple people come to me lately, they don't want to have that. What can they do about it? They're going to have that hyperkyphotic posture. They have that big hump, not just that gentle sway of that thoracic spine. They're going to have thoracolumbar hyperextension. Lots of times we think of a hyperlordosis when we were in the fitness industry. This is going to be above the lumbar spine. It's going to be at that junction where the T-spine and the lumbar spine come together, and it's going to have this extension. They're going to actually start to change the curves in their spine by starting to extend versus actually have that gentle kyphotic posture. You're going to see forward shoulders. Now, there's two ways we get our shoulders forward. There's an optimal way and a non-optimal way, and that's a discussion for another time. But I just want to show you the difference. When we have the forward shoulder where it's working on our breath, the forward shoulder is going to look like this. It's literally going to look like that scapula or that shoulder blade is coming up over top. That's the forward shoulder where my client isn't breathing well. Now, we know in order to work in front of us, our shoulders have to come forward. So those shoulders should wrap around. That's a more optimal way to get your shoulder around to get to work in front of you. Unfortunately, for many people, their shoulders come up and over this direction. They're going to have that compressed abdomen. What this means is you've seen it, that really thin person that has that poochy belly. And you look at that person, you say, how does that person who's thin have this poochy belly? Well, they're compressed. They're compressed from the top going down. And the biggest one is they feel tight all the time. If your client says to you, I just feel tight all the time, I just feel like I want to stretch all the time, they're telling you they're not breathing well. And I will tell you, as a past person who did not breathe well, that was a state that I lived in. And it's the state that we see in many of our clients. So those are what you will commonly see with your clients who don't breathe well. But what changes how my client breathes? Number one, trauma. This can be physical trauma, mental trauma, emotional trauma, spiritual trauma. If you've ever just gotten really bad news, just imagine that feeling of getting kicked in the gut. It changes how you breathe. Trauma oftentimes will put people in fight or flight forever until somebody helps to intervene. So trauma will change how we breathe. When you're in fight or flight, you're not taking nice, gentle, relaxing breaths. You're taking short breaths, short breath, short breath, short breath. Surgery. I have 2 specialties in my practice, teaching people how to breathe better and working with clients post-surgery. 5 days to 50 years post-surgery, working with clients, specifically women after abdominal, pelvic, and breast surgeries. Surgery will change the way you breathe for a number of reasons. 1, anesthesia will actually change how your diaphragm moves. As they put you under, your breathing slows and it actually starts to change how your diaphragm moves. Now that's one of the reasons that you have to take that, to do that breathing test, and the respiratory therapist comes in and makes sure that you got good lung expansion before you leave the hospital, because your diaphragm isn't working like it was before surgery. Because we need our diaphragm to pull the breath in as we inhale. And we'll talk about that in a minute. It will also change how you breathe for a number of other reasons. 1, the muscles that also help with breath become inhibited. You will also gain overactive muscles after surgery as it relates to your body trying to protect itself. Again, it will make it hard to get a nice expanded breath. Scar tissue, especially when we're talking about the chest, the breast, cardiac surgery, abdominal surgery, pelvic surgery, will create scar tissue. And again, that will impede the ability for your diaphragm to move fully. Illness. Even my young singer who has chronic asthma, she starts to get herself in a posture that doesn't allow her to breathe fully. This changes the volume at which she can sing. It changes the tone of which she can deliver the music. As soon as we can get her into a better posture, I'll literally have her sing or hum. And as soon as I get her in a better posture, the tone, the quality of the sound is improved. Asthma, allergies, chronic bronchitis, COPD, emphysema, all of these things will change how you breathe. Kind of along with some of those at the end there is smoking. Smoking will change the way people breathe. Just look at how people actually inhale when they're smoking. It's kind of the exact opposite of how we're supposed to breathe, and I'll show you that in a minute as well. And then finally, habits. Any of those that preceded, trauma, surgery, illness, will create habits that will drive how we breathe. It'll drive our posture, it'll drive how we move. If we're in pain, we turn into what now is non-optimal habits to move. Also, habits that we've learned over life. There's a number of kinesthetic, aesthetic cues that we will use that will actually start to change how we breathe. While you're sitting there, I ask you to do this little activity with me, and I can't see you, so I don't know if you're actually doing it. Although if anybody wants to jump on so I can see you, that would be awesome. What I'm gonna have you do is, while you're sitting there, I want you to, oh yay, somebody popped on, I'm excited. I'm gonna give myself a gallery view. Who else wants to pop on? Fantastic. All right, let's do this together. So if you're sitting or standing, I want you to go ahead and pull your abs in. It's a common cue we use when we're working out. It's a common cue people use aesthetically to appear thinner. So go ahead, sit there and just pull your abs in, keep them pulled in. And now I want you to try to take a deep breath in as your abs are pulled in. How does that feel? Was it super easy to get a nice breath in, or did it feel a little challenging? Yep, I got some thumbs down. Yeah, it was hard, but yet it's a common cue that we're given in fitness and aesthetically to look better, is to pull our abs in. Now, relax your abs, let them go. This is my dance. This is my let it go dance. I was doing this last night. I was kind of looking at myself and laughing at myself while I was online doing this. So now, while you're sitting or standing there, I want you to squeeze your glutes. Squeeze them like you would if you're coming up from a squat, and squeeze, but I want you to keep them squeezed, and I want you to take a breath in with your glutes squeezed. How did that feel? Good? Got that breath in there nice and low? Nope, I got some down. Now, shake it out, shake that booty out, just shake it out, let it go. Good. Now, once again, take a breath in and tell me if it feels a little easier. If so, give me a thumbs up. Awesome. Yes. Let's do one more. Another one we give our clients is, hey, stand up straight, pull your shoulders down and back. Do that for me. Good. Keep that nice posture. And now take a breath in. How did that feel? Some people are, I got some, I got some, Okay, now let that go. Shake it out. Okay. Now take a breath in. Did it feel easier? Okay, so now I want you to do this, because think of this one. Hey, I want to be thinner. What am I gonna do? I'm gonna pull my glutes in. I'm gonna pull my abs in. I'm gonna stand up straight. Do all that. Keep that, and now take a breath in. Where did you feel that breath go? Probably like right here, right? Okay, now you absolutely have to shake that out because I can't leave you sitting like that because that would be awful. So these are habits. They're habits oftentimes we use in fitness, and they're habits we use to make ourselves appear to look better, but they're also things that happen to our clients after trauma, surgeries, falls, car accidents. They start to get tight in very specific areas, and we're gonna go over some of those in just a minute here. Thank you everybody for jumping on. I appreciate that. It made that a little bit easier for me. All right, so really quickly, I wanna share with you why breathing is so important to me. Why, I'm just gonna start right here. All right, this is me. This is literally a Polaroid that I scanned in. This is about my 5th or 6th birthday, or my dad's, probably my dad's, because he's got the crown on. And at that time, around that time, my parents came into my bedroom. I had stopped breathing. I was blue and cold. They rushed me to the emergency room. They hooked me up to a whole bunch of things, but they couldn't find anything wrong with me. Now, people who know me may have said they missed something, but they couldn't find anything wrong with me. Around this same time, my mom came into the living room and I was on the couch. I was curled up in a ball and I was crying. And she asked me what was wrong. And I said, my head hurts so bad. It hurts so bad. And her answer to me was, you're too young to have a headache. Well, this went on for a few times. And then finally she took me to the doctor, and the doctor said, she's got migraine headaches. You need to change her diet. You gotta take dairy out. You gotta take chocolate out. You gotta take caffeine out. You gotta do all these things. Well, I grew up in Wisconsin. Dairy was never coming out of my diet growing up in Wisconsin in the 80s. But nothing else came out of my diet either. The other answer from my mom that they gave her was, here, give her this tiny little pill. When she feels a headache coming on, she should put it underneath her tongue. I was 5, 6, 7. I never knew when a headache was coming on. It just came on. As I got older and got into being my teenage years, yes, this is my big 1990s hair from my senior picture. As I got older and the hormones kicked in, the headaches got worse. So the next thing was to put me on birth control. Enter into my mid-20s. As I'm in my mid-20s, I now become a massage therapist. I now have a physically intensive job. And at that time, I had headaches every single day. I would get in my car at the end of the day and I could barely turn my neck to look over my shoulder while I was driving. My arms and shoulders were so weak, I needed to actually use 2 hands to turn on the radio in my car. I was taking 1,000 milligrams of ibuprofen a day. I was rubbing every kind of ointment on my neck and my shoulders and getting massages and doing all these things to hopefully get rid of these headaches, the shoulder pain and the neck pain that had really started to kick in. And then I met this guy. You might recognize him. He's Dr. Evan Osar, and he is my husband. I was about 27 years old when I met him, and he knew my struggle with headaches. We started working together and really starting to assess what was going on with my body. He said, Jenice, do you know that your entire spine has been reversed? Your entire spine is in this C curve. And he said, your rib cage is about this wide back to front. Well, that didn't really mean anything to me. But then as I thought about it, every personal trainer that I worked with would always say, Jenice, you need to breathe more. And I would say, I am breathing. They were like, no, you need to actually like breathe. But I would. But when Evan really started talking to me, he started to ask me questions about my history. Like, what were some cues? What are some of the things? And as he started to watch me move, he realized that I was always squeezing my glutes in, pulling my chest up and back, and pulling in my abs. Because that is what my mom taught me to do as a little kid as I started to get chubby. This is how she told me to stand up straight. This is how she told me to appear thinner. And back in that time of my life, I was an excellent rule follower. So I did exactly what my mom said. And then when I started playing sports and I started doing exercise classes, what were the cues that I heard through all of these things? Squeeze your glutes, pull your abs in, pull your shoulders down and back. So I lived like that for almost 27 years. It's 20 years later, and I'm really happy to report to you that I have not taken any kind of pain medication in almost 20 years. If I have a headache, it's once a month. It's very cyclical with my cycle. Or worst case scenario, I drank too much red wine, not enough water, or I've traveled too much and I've not drunk enough water and I'm just exhausted. It's very self-induced now when I get a headache. And the number one thing that's changed about my life is how I've changed my posture And that has been done by changing how I breathe and when I do it. So that is why breathing is so important to me, because it has literally changed the trajectory of my life. If I was that same person 20 years later, I would not be standing here, because I would be the saddest, most depressed person I would know. So let's look at a couple of research things before we get into doing the work. So these are some recent research studies. And if you want to grab a screenshot so you can go read the whole research study, I encourage you to do that. But this one talked about the impact of the diaphragm function on balance maintenance. So a deterioration of the diaphragm function impacts balance. When we teach balance classes, we teach fitness professionals how to teach balance. One of the number one things we teach you is how to breathe, and how that is important, and how it truly impacts how your client is able to balance. All right, this one here, the effects of the head and neck posture, that forward head posture we were just talking about. The results show that even in healthy subjects with no previous history or mechanical or physiological dysfunction induce forward head posture when they don't breathe correctly. It resulted in an immediate effect on respiratory function, even when subjects who assumed forward head posture just for a short duration of time. We use muscle testing as a way to help our clients feel kinesthetically what's happening in their body as we're working with them. What we found was that when we change our clients' head posture, for many of our clients, it will change how they're able to access and stabilize their bodies. All right, this one on failed back surgery syndromes. Failed back surgery syndrome in low back pain, diaphragm is higher, there is less excursion, and fatigues more easily. This is what I was talking about with surgery. I have a client who had 2 failed low back surgeries. The number one thing I started with her is teaching her how to breathe better. When she is stuck, when she doesn't feel great, she will call me and say, Jenice, what do I need to do? And I'll tell her, let's do your breathing. And she will start to feel better, because you have so many muscles that are intricately located next to, combined with, fascially blended with your diaphragm, which we're going to go through that in a second. One more here. The impact of the diaphragm muscles on the fiber atrophy and neuromuscular control. The emphasis on improving respiratory muscle fatigue, resistance, and endurance is misplaced, since respiratory muscle weakness may be the culprit in the progress of disease. Improving muscle strength may affect how far and greater beneficial results. All right, so let's talk about some important muscles when we talk about breathing. Our primary respiratory muscle is the diaphragm. This is a picture as though the diaphragm is peeled back. Your diaphragm is a 3-dimensional muscle. It sits on the inside of your rib cage. It's attached to your rib cage. It is attached to your spine. And then we also have your intercostal muscles, which you find in between each set of ribs. They're responsible for helping the ribs open as you inhale and not collapse as you exhale. Looking a little bit more closely, this top picture right here, this is the view as though we're looking up into the diaphragm. So it's like the umbrella coming open. We're looking up into the diaphragm. So we're looking, this is the lumbar, thoracic and lumbar spine. We're looking up into the diaphragm. Again, you can appreciate the attachments of the diaphragm to the spine. Along here, these little white areas are the rib cage. And it's attached on the rib cage, remember, all the way around. The front, inside, and the front backside of your ribs. What we also want to appreciate here, this muscle here, is the transverse abdominis. Again, the front is pulled away. Remember, the transverse abdominis wraps around our rib cages, and our internal corset lies below the more superficial abdominal muscles like our obliques and rectus abdominis. The diaphragm fascially blends into the transverse abdominis, and it fascially blends, if you look at this picture here, fascially blends into the psoas muscle, and then the psoas muscle fascially blends into the pelvic floor muscles. This is a really important concept when we start to talk about stabilization and mobilization as well. So again, we have the diaphragm here, this 3-dimensional muscle. When we inhale, it descends. When we exhale, it rises. When we inhale, it should descend. When we exhale, it should rise. This is important, and I'm going to show you in a minute here, because when we do this, the pelvic floor muscles should do the same thing. So as we inhale, the diaphragm descends, the pelvic floor muscles should descend. As we exhale, the pelvic floor rises, as does the diaphragm. They need to work together. So the role of the diaphragm is respiration, stabilization. As you can see, it's attached to the spine, so it helps spinal stabilization. It helps the transverse abdominis create stabilization and mobilization. If you can get your client breathing well, if you can think of your clients who are so stiff, especially in that rib cage, in that thoracic area, if you can get them breathing three-dimensionally, you're going to help so much with increasing the mobility of their spine. All right, let's also take a really quick look at the accessory, some of the accessory muscles of respiration. Now, an important cue here, important thing to keep in mind, these other muscles, these accessory muscles, should only work when we are taking in deep or fast breaths, and when we're exhaling. These should not be working all the time. We're just doing quiet breathing. Now, really quickly, sternocleidomastoid muscle, just as it says, it comes from your mastoid process behind your ear, comes down here, has two heads, one inserts on the clavicle, one onto the sternum. Your scaling muscles, they are inserting onto your ribs, as well as your transverse processes of your cervical spine. Pec minor, remember when I told you the forward shoulder? Pec minor, remember, is going to come off the coracoid process here of your scapula and inserts along the ribs. It's going to be what pulls that forward shoulder up and over, okay? That one when it's being overused. Serratus anterior, the front of the scapula wraps around onto your ribs. Serratus posterior superior sits underneath your rhomboids, goes from your spine out to your ribs. Iliocostalis cervicis, it goes from your ribs up to your cervical spine in the back. Rectus abdominis, our large top to bottom abdominal muscle, our obliques that wrap around. Iliocostalis fibers, these are your erectors. Both the iliocostalis and the longissimus are both those big erectors. Lots of times speed bumps for so many of our clients would literally feel like speed bumps in their back. Serratus posterior inferior is going to be down by our QL, but again, it goes from the spine out into the ribs. And then that ever dreaded QL or quadratus lumborum, which goes for your 12th rib down to the top of your iliac crest. Again, keep in mind, these muscles should only be working when we're exerting ourselves. We should not see the SCM or the scalenes poking up when our clients are just doing regular breathing. So if your clients have these muscles are tight, what's one thing you think they're probably telling you? I don't breathe well. If your clients are always tight in those erectors, they're saying to you, I probably don't breathe well. All right, so let's take a look at what some suboptimal breathing strategies look like. This one is just belly breathing. Lots of times we want people to just breathe into their belly, or what we've been told. But look what happens when he breathes into his belly. That's the only place he breathes. And look at, now this is what splayed ribs look like. Because he only breathes into his belly, he's now literally started to stretch out the muscles and fascia of his abdomen. He's not able to get that rib cage to stack down over top of his pelvis. So that's a suboptimal strategy of just belly breathing. This next one is a woman who actually does reverse breathing. As you watch, as she inhales, her whole chest comes up because she's literally sucking her diaphragm up. And then as she exhales, it's coming down. So remember I said, when you inhale, the diaphragm should come down. As you exhale, it should rise back up. So she's actually reversed the way that she breathes. And this is a common thing you're gonna see. If you can see this really flat area on her rib cage there, like extra flat, that's oftentimes signs of a person who has reverse breathing. All right, I'm giving credit where credit is due because these are literally taken off of Facebook from the Stockbridge Osteopathic Practice. But it shows you again what happens when we breathe and why it's so important that we breathe well. Okay, so what we're looking at here, this is the front of the body. This black area is the diaphragm. This big organ right here is the liver, and this is the backside, so these are the kidneys. Now remember what I said, when we breathe in, the diaphragm should lower, so should the pelvic floor. So you can see the person inhales, everything goes up. They exhale, they inhale, everything goes down. They exhale, it rises up. This person's breathing pretty fast, but you can see this is so important because you must have that excursion so that those organs can be mobile as well. This is a really important thing. If you have clients who've had, I'm just gonna play that again while I talk so you guys can see that. If you have clients who've had abdominal or pelvic surgery, C-sections, hysterectomies, gallbladder, appendectomy, surgeries for cancers, exploratory surgeries, organ removal. You have to get them breathing three-dimensionally so they can get those organs moving so that scar tissue does not get stuck and entangled around there. You have to keep those organs moving after those types of surgeries. Okay, this is another one from Julie. We posted this, but it actually comes from @ThinkBeyondPain. They actually put up some really great stuff. This is from Instagram. Again, we're gonna start looking at what they call chest breathing, and we're looking here at this area right here, the pelvic fascia, as a person chest breathes, and then as they turn into what they call belly breathing, but it's more three-dimensional breathing. So if we look right here, we can see this pelvic floor fascia is not really moving a lot as that person is just chest breathing. But once they change that breath, now all of a sudden we see these pelvic floor muscles and fascia start to move. That's why getting your clients to breathe well is so, so important. Okay, so what is three-dimensional breathing? It focuses on accessing, remember, that whole entire diaphragm, that whole three-dimensional muscle. So guess what? We're not gonna have our clients just do belly breathing. It helps create space, mobility of the rib cage and thorax. Like I said, when that diaphragm comes down, it creates space for the lungs to fill. It actually helps fill the lungs with air. So now our clients are gonna get more mobility just in their spine as they're breathing better. And it creates stabilization of the spine and trunk via intra-abdominal pressure. That's what IAP is, intra-abdominal pressure. Just think when you breathe in and you breathe in well, you can start to feel tone in that trunk and in that abdomen. And then remember, we have that transverse abdominis muscle that wraps around from the front to the back, inserts fascially into our spine. Okay, we start to create that intra-abdominal pressure. It also activates the deep spinal and hip stabilizers. That means, here's my diaphragm. This is the back. You're looking at the back side. Deep inside are little muscles called multifidi. They actually blend in with the diaphragm as well. They link segment to segment. They must turn on before we move, along with the transverse abdominis. Also, the psoas muscle helps to stabilize the spine. If it's insertions along the lower thoracic and the lumbar spine, it also helps to stabilize the hip socket where it inserts as well. So breathing helps through these fascial blended links, helps to activate those deep spinal and hip stabilizers. Remember, it's a fascial blending of these muscles together. We've actually got to see this in anatomy labs, which is so cool. You can actually see these fibers blending together like this. It's so amazing. It just gives you more of that visual, if you're a visual person, as to how breathing can help activate these deeper muscles. So again, creates mobility, creates stabilization. All right, so the ABCs of improving efficiency when we talk about performance. If you go back to Marsha's story, Marsha didn't like her posture. So one thing we're looking at is improving posture when we improve breath. She was able to sustain, stay awake, have more energy during her day. We were able to improve her performance. And Marsha started to incorporate breathing into her workouts as well. And she said she did not get as tired during her workouts either. And she says she does really hard workouts. So getting her to breathe differently helped her posture, helped her move better, and helped her perform better. Now, performance is a very personal thing. What do I need to do during my day to perform? Do I need to be able to work better, longer? Do I need to exercise better? Do I need to play a sport better? So remember, performance is a subjective thing. What's important to your client? So we have to improve alignment. We need to improve breathing, and then we need to put that into their exercise program under control. So the ABCs. So we use the integrated movement system. This is what we've created. There's 3 phases, and we're going to go through these and we're going to work on this together. Discovery. You have to know your client's medical history. We talked about a number of medical scenarios your client may have gone through in their life before they come to meet you, or you should think about your clients you work with right now. They may have had surgery. They may have had trauma. They may have been in car accidents. They may have sprained an ankle, broken an arm. You need to know what their medical history is. And then you assess them. I'm going to give you 4 simple assessments so that you can show your clients that breathing is helping them, and so that you can see that breathing is helping you as well. In the address phase, which is our second phase after we've looked at our assessment, we need to release some muscles. If you go back to our list of muscles we talked about, oftentimes the erectors may need to be released. We may need to release some of their abdominals. I want you to add this one to the list, glutes. Remember when I had you squeeze your glutes and take a breath in? It was a little bit harder. Remember how I said the pelvic floor and the diaphragm have to move together? So while you're sitting there, do this again. Go ahead and squeeze your glutes and try to let your pelvic floor relax while your glutes are squeezed. You may have found it's kind of hard to do. It requires a lot of brain energy to squeeze your glutes and let your pelvic floor relax. Again, you need that pelvic floor needs to be able to move inside that pelvis. And if you're squeezing those glutes, it's gonna be really hard for that pelvic floor to come down. So you may find if your client has decreased hip range of motion, you may need to have them release their glutes so that you can get that space open for that breath to come down. We also want to activate those muscles that aren't really stabilized anymore. And we're going to do that through our breath. All right. And then we want to take this concept and integrate it, help our clients integrate that breath work into their ADLs, their activities of daily living, as well as their exercise. All right, let's go ahead and do this together. I'm going to stop share for a second. So if you guys want to pop up on the screen again, that would be awesome. And we're going to do this together. All right, so go ahead and stand up. I told you I was going to give you 4 assessments you can do with your client. It will also empower your client to do this on their own so they can feel how awesome you are even when you're not with them. But it will also, it's a great, easy 4 assessments you can do if you do small group personal training or you do group X, okay? So I want you to just stand there. Bring your feet relatively together. You always want to cue your client to do this the same way each time so that they're measuring from the same space. Okay, so as you're standing there, go ahead and put your hands on your hips. And you're going to turn your whole body to the right. Keep your feet on the floor, turn your whole body to the right, come back to center. Turn your whole body to the left, come back to center. As you repeat this, always stop in center. Do you turn easier to one direction versus the other? Does it feel easier to go to the right or to the left? And what does the quality of the motion feel like? Does it feel like it just smoothly goes there? Or do you have a hard stop as you turn one direction versus the other? Okay. You may or may not feel a difference. Oftentimes people do. Okay. So we just checked our hip range of motion. We want to create symmetry when working with our clients. The next one is your arms are going to be at your side. Your thumbs are facing towards me. I want you to bring both arms up overhead. Good, and bring them down. And now just do one at a time. Does one move easier? Does it feel lighter? Do you have any stickiness? Do you have any like crunchiness or cracking? Do they feel heavy? Does one feel easy? Are you able to keep them close to your head, or do you feel like it almost has to come out like this to get it up higher? Okay, so we checked our hips, we checked our shoulders. Now let's go ahead and check our neck. So you're going to, arms are going to rest at your side. You're going to turn and look over your right shoulder, come back to center, and look over that left shoulder. Come back to center. As you do this, again, does it go easier one way versus the other? Does it feel a little sticky, a little crunchy, a little like, like I just want it to go further, but it won't? Okay, so you want to look at the range of motion, but you also want to look at the quality of motion. Does it go smoothly, or is there a lot of to kind of get it there, okay? The last one we're gonna look at is actually balance. So if you're not super steady on your feet or you're not feeling super steady today, have something close by like you would with your clients. And now I just want you to go ahead and stand onto a single leg and switch sides. And as you do that, do you feel like there's a lot of effort to go from one leg to the other? Does it just feel easier to stand on one leg versus the other? And how heavy do your legs feel when you lift them? Does it feel like it requires a lot of effort to lift those legs, or do they feel like they just kind of float up? Okay, go ahead and jot some notes. How did you feel? How did your neck feel? How did your shoulders feel? How did your hips feel? And how is your balance? What did you notice a difference side to side, if any? Also note the quality. Ooh, it was a little ratcheting as I tried to turn my head to the left. There's a little twinge of discomfort as I turned my head to the left. There's a hard stop as I tried to do something. Okay, so now I'm gonna have you sit in your chair. Now, we're gonna go through breathing. Here's a caveat. We're gonna do it in seated position just so I can see you all. You can do this in lying supine on your back. You can do it in the prone position, and you can do it in sideline. If you're working with people who are pregnant or just can't lie on their side or their back, you can also do it in sideline. You can do it in standing. It is the most difficult way to do it. We're fighting a lot of gravity in standing. However, it is still a way you can do it. If you have a client who works on their feet all day and they have to stand, but you want them to spend a little bit of time getting some good breaths, it can be done. So you're gonna go ahead, sit, perch yourself on your chair. So you're sitting towards the front of your chair. And I'm gonna show you something extraordinarily unladylike, as my mother would call it, but it's so that you can sit in your best posture. Okay. When we're sitting here, we want to make sure that we're sitting up on our sits bones, those bones that we have in our butt. So what I want you to do is I want you to pick up your glute, pull it out and back, and do the same thing on the other side. Pull it out and back. So what happens is now you're sitting on the squarest, broadest part of your pelvis. It's where you're actually supposed to support the weight. Oftentimes what happens is as we sit for too long, we start to do this. And we start to end up sitting on our tailbone and not on those sits bones. So we're gonna go over how to teach three-dimensional breathing. It's 3 steps. Well, it's kind of 4 steps. So remember, the diaphragm comes down like this, right? So I wanna make sure I'm helping my client's brain find those 3 dimensions. Because how many of you have clients who breathe really, really well into their belly? You can see their belly move when they're breathing. Well, we want to start to expand it into more of 3 dimensions. So what I want you to do while you're sitting there is you're going to put your hands just inside your hip bones with your fingers facing down towards your pubic bone. We are going to breathe in through our nose and out through our nose. A couple of reasons why. We were born with this really nice natural filtration system in our nose. It cleans and warms the air when we breathe in. So we want to breathe in through our nose, okay? If your mouth is open, you're just going to catch something in it and you don't want to do that. That's why you breathe through your nose, okay? So we're going to breathe in through our nose and we're also going to breathe out through our nose because it is just a longer path of air and it helps slow the breath down. So your hands are going to be here and I want you to think about sending your breath. Note my words, send your breath. I don't want you to push your breath. I don't want you to bear your breath down to get it down there. I want you to feel your fingers there and think about sending your breath down into your fingers. So you're gonna take 3 gentle breaths. If you want to, close your eyes. Take 3 gentle breaths, sending that breath down into your hands. And then as you exhale, I want you to exhale gently, but fully. Let that breath come all the way out. When you finish your 3 breaths, just go ahead and open your eyes for me so I can see you. I know that you're done with that. Good. Okay, that was 1 dimension. Now we want to go into the next dimension. So if you can comfortably, I know I have a couple men on here, but ladies, if you just want to wrap your hands gently around the area of your bra strap. Okay. So if you're comfortable, you can even slide your thumbs around just a little bit into the back. That's great too. Now we're going to think about getting our breath lateral out into our hands. So again, this isn't a real big, not this, right? You want to think about just gently sending the breath out into your hands. So you're going to breathe in gently through your nose. Go ahead and close those eyes. Feel your hands there on your rib cage. Gently breathe in through your nose. Allow that breath to come out into your hands. And then a nice, full but gentle exhale. Let that breath come all the way out. And you do 3 breaths there, nice and gently into your hands. And a nice, full but gentle exhale. Let that breath come all the way out. Good, a nice gentle breath in through the nose. Feel your hands there. Allow that breath to expand out into your hands. And then as you exhale, exhale fully but gently. Let that breath come all the way out. Very nice. Okay, now if you're comfortable with your hands there, just keep your thumbs in the back. If you're not, you can wrap your hands around like hugging yourself. That's okay too. But but I don't want you to jack yourself up while you're trying to breathe well. That would just be silly. Okay, so now I want you to feel your thumbs back here. If you've wrapped your hands around, I just want you to feel those thumbs there. And now you're gonna think about that breath coming in through your nose and going down and out to your hands, nice and gently. Okay, so feel your thumbs there. Remember, you have a back side of the diaphragm. Now we're thinking about accessing the back of the diaphragm. So breathing in nice and gently through the nose. Allow that breath to expand out into your back. And then exhale fully and gently. Allow that breath to come all the way out. Breathing in through your nose gently, sending your breath into your back. Exhale fully and gently. Allow that breath to come all the way out. One last breath there. Allow that breath to gently come into your hands. And then exhaling fully and gently through your nose. Good. Did you guys find that there was one area that was a little harder to get into, like your back or the sides? Did you find it was like a little bit harder to get your breath into there or feel your breath there? Maybe, maybe not. I'm just getting a bunch of looks. Okay, all right, so now what I want you to do is you're gonna close your eyes and I want you to see if you can find that breath in all of those areas. So I'm gonna talk you through it, just listen to my voice. Go ahead and close your eyes. Okay, very gently again, we're gonna be breathing in through your nose. Allow that breath to go low into that pelvis, out into the sides, and into your back. You're gonna exhale fully but gently out through the nose. Allow that breath to come all the way out. Nice gentle breath in. Allow that breath to go low into the pelvis, out into your rib cage, and into the back. Exhale fully but gently. Allow that breath to come all the way out. One last breath here, breathing in gently through your nose. Allow that breath to go low into the pelvis, out into your rib cage, and along the back. Exhaling fully and gently, allow that breath to come out all the way through your nose. Good, and relax there. Okay, go ahead and stand up. Remember, we're always going to assess in the same position. So your feet are relatively together. Okay, your hands are gonna be on your hips. Okay, and you're gonna go ahead and turn to the right, come back to center, and turn to the left. Come back to center. As you do that 2 more times, appreciate, is there more equality side to side? Do you have more similar range of motion or improved range of motion? Does it feel easier to move now? A little freer? Good, okay, now we're gonna stand hands at our side, thumbs towards me. You can bring both arms up overhead. Good, and bring them back down. And then just do one at a time. Do they feel easier to lift? Do they feel floatier, less effort? Is there less crunching or cracking? Is there more quality side to side? Okay, now still standing there, arms at your sides. We're gonna go ahead and check our neck. So you're gonna look over that right shoulder, come back to center, over that left shoulder, come back to center. Repeat that again, looking for how does that range of motion feel side to side? Do you feel improved range of motion? Does it feel easier to look? Is it smoother? Good, and then that last one, let's go ahead and check our balance. So feet together, arms at your side, and go ahead and just raise one leg and put it back down, and then the other leg and put it back down. And again, as you're doing that, do the legs just feel easier to lift? Do you feel more stable? Do you feel more grounded? What does it feel like as you do that? All right, if you're on the screen, can you give me a thumbs up if you felt a change anywhere? Awesome, that's fantastic. Now, how do we put the breath into common exercises and into our clients' everyday life? So when we use breath, when we're teaching our clients how to start to use breath, we oftentimes need to get them to be very gentle. And so sometimes it's almost gonna feel like a reverse breathing. So we call it more of a corrective breath because we actually help our clients relax while they're going into some of their squats, lunges, things like that. So if I'm gonna teach my client how to incorporate breath into a squat, remember one of the things I said a lot of people do is they like to squeeze those glutes. So I'm gonna tell my client to go ahead and take a nice gentle breath in. I'm gonna have them start the exhale, and then I'm gonna have them go into that squat. Breathing in then to come up out of the squat. Have them exhale, start the exhale, and sit back. Start the inhale and come back up. Because what I'm having them do with that exhale is helping them relax their pelvic floor, relax their glutes, so there's space for their hips to move. I may even cue them and say, I want you to start the exhale and think about letting those sits bones open and then go into your squat, creating that space. So let's do 3 of those together. So you're gonna inhale gently, start the exhale, think about letting your sits bones open and go down into your squat. Start your inhale and float back up. Exhale, let those sits bones relax and squatting down. Start that inhale and float back up. Exhale, let those sits bones relax. Inhale and float back up. Do me a favor while you're standing there. If your hips felt tight, I just want you to test them again. Tell me if they feel even better now. Hands on your hips and go ahead and rotate to the right, come back to center and to the left. Did anybody notice anything more when you did your, yay, I love the thumbs up, woohoo. Yes, so remember one thing we like to do oftentimes in our squats is we do a lot of squeezing of the glutes. If we're able to create space for those hips to come in there using our breath, then we can load the glutes properly while maintaining our hip motion and range of motion. Cool, all right, so let's do another one. If I'm gonna have my client go into something like a split squat, I'm gonna do that same thing. I do my split squat, especially with my older clients who are just learning how to do this, or my clients who don't have great balance. I'll even give them a chair to hold on to. I have them go into just like a mini squat. They slide back and everything is the same. They inhale to come up, exhale, let that sits bones relax and come down. Keeping a weight on that forward leg. Inhaling to come up, exhaling to go back. So again, we're incorporating everything we were talking about. I still want them to think about that 3-dimensional breath as they're doing these. If my client needs to get more range of motion in their shoulders, oftentimes we'll have them start on their back with something really light. So I'm on my back right now, the floor is here. I'm gonna have my client breathe in. As they exhale, they're gonna move overhead. Inhale to come back. Exhale to go over. Inhale to come back. Because remember, there's muscles that are tight, like their erectors. Oftentimes their lats will be tight too. I need them to get to move without the rib cage coming along. So I use the breath. Exhale, the ribs come down and the arm goes overhead. So if you guys just want to try that once. So just have your hands here. Take a nice gentle inhale into your 3-dimensional breath. Start your exhale and let your arms come up. Inhale to come back down. Now the important thing is if your client starts to do this, you want them to stop before that because their arms should move independent of their rib cage and spine. Does that make sense? When they bring their arms up overhead, this shouldn't happen. That's a compensation to bring their arms up overhead. So it's inhale, start that exhale, and let the arms come up. Inhale to bring the arms back. Exhale to bring the arms up. Inhale to bring the arms back. So you're then teaching your client to use their breath as control so that they're only using their arms to go overhead. Because how many of your clients have really, really tight erectors? Their back is really tight, right? Because if every time they go overhead, to do something overhead, they're doing this, they're using a lot of muscles to try to bring their arms up overhead. So you can use your breath to help them then start to keep that rib cage down and move just their arms. Does that make sense? Cool. Okay, we have 15 minutes left. I'm just going to finish up this. I just have a few slides to finish up, and then I'll have you guys can ask some questions. Oops, that's not what I wanted. All right, Lindsay, can you just jump on? Can you guys see that slide okay?
You're good.
Okay, thank you. All right, so if you notice, a lot of the cues that I gave you, probably all of them, were very gentle cues. I want you to think about sending your breath into this space. You can use things like imagine your lungs filling up with air. See your breath filling. See those sits bones expanding as you breathe in. Allow your breath to go into this space. Gently send your breath. Use very light cues because otherwise people are going to want to bear down and try to get their breath into a space. Now, I did recently have a client tell me that there is actually a disorder where people can't imagine, and it was a word I'd never heard before, so forgive me for not remembering what that is. In that case, use your kinesthetic cues. Either you put your hands on your client if you can, or if you're working virtually or you can't, have your client put your hands on their pelvis, on their rib cage, along their back. You can also have your clients use a towel or a yoga strap around their rib cage if they can't get their hands in certain spaces. This is my client, Sunita. She is my first Kenyan client. She is literally living in Kenya, and she reached out to work with me. And she said to me the other day in our session, she said, we never realize how much we need to use breath because we start our sessions, she doesn't feel great. And everything we do includes her paying attention to her breath and getting her to breathe three-dimensionally. And she said, I asked her if I could have a picture of her, and she said, yes, but it's me before I decided to go natural gray. So see, Sunita as well is 72 as well, and she's been a rock star to work with. All right, so you guys, if you downloaded the handout, here are a couple of the questions, and I call this action because here's your action step. So what are the common signs your client shows you that tells you that they're not breathing optimally? Remember, we talked about those different postures, the splayed rib cage, the barrel chest, the forward shoulder like this, the forward head carriage. They tell you that they're tight all the time. If you see a client who's always holding their abs in or always squeezing their glutes, or you can just see their neck muscles all the time, they're also telling you that they're not breathing optimally. What are the common muscles that can be tight that would make breathing optimally challenging for your client? Remember, those are those muscles of respiration we talked about, those neck muscles, those erectors. I told you to add the glutes. You can also add the lats. So you are going to want to do release work if you can with your client before you have them do their breathing. It will just make things easier. But as you noticed already, if you don't have those things available to you, that's okay too. You saw it in yourself that breathing alone helped change your range of motion. But refer back to that list of muscles that you want to look at in your assessments that might be telling you that you need to help your clients release some of those muscles. What are common causes of why our clients don't breathe optimally? Remember, we have surgery, trauma, habits, and then what are the benefits of breathing three-dimensionally? The biggest things we talked about today are including mobility and stability. Mobility of the rib cage, mobility of the hips, mobility of the neck. You guys started to feel that mobility of the shoulders. By changing how you breathe and adding three-dimensional breathing into your practice, it makes you stop holding and tightening down in certain areas, which will then give you more range of motion. Also, it helps create stability. And remember, we're doing that through the fascial blending of the diaphragm with the psoas, which then blends into the pelvic floor. But we also have that blending of the diaphragm into the transverse abdominis, which remember is our own internal corset as well. What are some easy ways to introduce breathing into your programs? I would say make it part of your warm-up and part of your cool down. use these 4 easy or 1 assessment, but I give you 4 easy assessments you can use with your clients. Your clients can do on their own to make sure that they're staying on track with the programs you give them to do on their own. But have your clients do those assessments, incorporate breathing as part of your warm up or cool down to start. You can also use it as part of your program when you're getting clients to other warm up. Maybe you want them to do some squats as part of their warm up. Have them do this corrective breath where they exhale and let things relax so they can move deeper into their squats. So if you would do me a favor, what was your biggest aha moment from this session? And what is one of the first action steps from this session? Can anybody drop those in the comments for me? I'd really love to hear your feedback.
Say that again.
Yep. What was your big aha moment from the session today? Like what was like, oh, wow, that's really cool, or that's really interesting. And then what is an action step that you can take? Okay, I see my own deficiencies that I can improve on. Yep, absolutely. How easy it was to breathe and improve range of motion. Yep.
Yep.
What else? The forward shoulder. Yep, that's a really big one.
Forward neck. That was.
Yep, the forward neck. Yep, make it part of my day. Yes. How I move after breathing. Yep. Awesome. Thank you for sharing. I'm just going to go ahead and finish this up, and then I'm happy to answer your questions. All right, so the reason that I'm here talking to you about breathing, this is Bonnie. The last session, the last FAI session that we could be in person at, Bonnie was in our pre-con, and Bonnie went to go raise her arms in the assessment, and her arms kind of looked like this. And she kind of looked at me like, oh, and her neck kind of didn't turn so great. And Bonnie did exactly what we just did. And we got done, and Bonnie and I are standing there, and she's doing her thing. And all of a sudden, both of her arms just come up straight up over her head. And we both just started crying. It was the most amazing thing. It was so lovely. And that's like a quick snapshot somebody took because we were just both so excited. And that actually led Bonnie to join us in Arizona at a session similar to this. And this was, we teach a 3-day course, and this was day 3. We're asking people in this session, what was your biggest takeaway? And this is what they had to say.
It's the TPC, because I think that with the breathing, it's going to be easier on the client. I don't have
applying the breathing techniques to improve efficiency. Aha moment this weekend was really how much or how little it takes to see the changes with a lot of just the breathing. So for the breathing, correct breathing.
Awesome. It's really one of the first things that I'm going to bring back is the breathing and having more purposeful breathing with purposeful movement on pulsars. Yeah, that's great.
So even at the end of 3 days of information, the breathing was still number 1 in what they thought of was their big aha moment. And this guy is super close to my heart. This is my dad. This picture here with his beard was my dad pre-breast cancer, and the picture afterwards was him growing his beard back. And I do love this quote: all chronic pain, suffering, and disease are caused by lack of oxygen at the cell level. My dad was a lifelong smoker until 3 months before he found out he had breast cancer. He actually found a black spot on the inside of his lip, and so he quit smoking and didn't tell any of us until after he was done with chemo that was why he quit smoking pipe. Unfortunately for my dad, chemo kicked off a lot of underlying issues for him. He quickly developed pretty significant AFib. He also it brought out COPD, congestive heart failure, emphysema. So he's currently on oxygen all the time. However, as I prepare for these lectures, I asked my dad to take some stats for me because he loves machines. So my dad has a pulse oximeter. He's got a blood pressure machine. He unfortunately is diabetic as well, so he has to check his blood sugar all the time. And I asked my dad as we got ready for this session to take his stats 3 times a day for me, do his breathing in the morning, the afternoon, and the evening, and take his stats before he does his breathing, after he does his breathing at every session. And his blood pressure went down every single time. His oxygen levels improved even if he wasn't wearing his oxygen. There was one day where he wasn't wearing his oxygen saturations were down into the high 70s. He did 5 minutes of breathing and they were up to 94. So his saturation always goes up. His heart rate always goes down. even his blood sugar, which was a little out of control, which I think he stopped sharing that with me, even that went down every single time he did his breathing. So even with somebody who has advanced conditions as my dad, helping them breathe better and get into breathe three-dimensionally actually helps. We have statistical proof that actually changed the stats and systemic things with him. So I'll leave you with this. Breath is the finest gift of nature. Be grateful for this wonderful gift. I know that it has changed my life. It's changed the life of many of my clients. If you guys have not read this book, Breath by James Nestor, I opened up the book yesterday and I've never seen this before. And it said, no matter what you eat, how much you exercise, how skinny or young or strong you are, none of it matters if you're not breathing properly. So I would encourage you to get this book if you have not already read it. There's a lot of research type stuff in it, but it's written in layman's terms, and it's really an extraordinary book. I just open it up sometimes and read a couple pages just for inspiration. The pictures that you saw, the anatomy pictures, were taken from Dr. Evan Osar's book, The SOAS Solution, which is available on Amazon. And listen, if you would like to learn more about how to help your clients or yourself breathe better and do the activities they need, want, and love to do, please reach out. I would love to hear from you. And here's where you can follow us and learn more from us. We are from the Integrative Movement Institute. We teach the integrative movement system, which I gave you a little insight into today. You can find us at iihfe.com. And there's my email address. If you have questions that come up afterwards and you'd like to ask me, please feel free to reach out. Like I said, I would love to hear from you. So Lindsay, I'm going to stop there.
Ooh, you never fail to inspire and outdo yourself every single time. That was phenomenal. Thank you. We do have just a couple minutes and there's been a few questions. It came up a couple times, so I think it's worth bringing up again. Can you talk a little bit more about nose versus mouth breathing, what you suggest? Talk a little bit more of that because that came up a few times.
Nose versus mouth breathing. Well, remember, and I always come back to this. Every once in a while, you're gonna find somebody who can't breathe well through their nose. Maybe they have some kind of condition or something like that. Do the best you can. Put them in the best position for breathing. Getting your clients in the best position for them is essential. If you have clients who have really bad forward head, but you want them to lie on their back and work on their breathing, you're gonna need to support their head in a way so that their head and neck are in alignment with the rest of their body. People do like to breathe in through the nose and out through the mouth, and that's okay. This is just the way that we choose to do it. We've had great success with it. There's lots of different ways to teach breathing. My biggest thing I hope you took away from this is really understanding the idea of three-dimensional breathing, not just belly breathing.
Great. This came up 2 or 3 times. Any thoughts, suggestions on those who are post-COVID?
Yeah. That's a good one, right? Well, that's a whole, okay, I'm just gonna stop.
we can pass that. It came up 2 or 3 times, so.
I will say this, that as best you can, help your clients, give them kinesthetic cues, because if they had COVID and they really struggled with it, say they were intubated or anything like that, they're still trying to recover, they're having those long haul symptoms, give them those kinesthetic cues. Their brain has probably disconnected from getting their breath into that space. Remember, if they were sick and they couldn't breathe, they're probably compensating a ton just to get air in. Use your release strategies, your foam rollers, your balls, your activators. Use these things gently. You don't have to mash and kill, and pain is telling your body, is telling you something's wrong. So don't mash and kill. Lightly, even this, I'll have my clients just go up against the wall. I'll have them stand against the wall with this in their erectors and just get their breath into that space. Imagine your muscle melting over the ball. Don't try to mash your muscle into the ball. It's about getting that awareness. Their brain is likely disconnected. They've compensated all over the place just to get air in. So again, use your kinesthetic cues, use your release strategies, things like that. They were sick. Like what happens when we get sick and we have to breathe, we're going to do whatever we can. Our body will do whatever it can to breathe.
Your cueing is so helpful. Can you talk a little bit more about how breathing affects balance?
Yep. So remember, if my client, and this is the whole class, I'm going to try to do this in like 1 minute. If my client is super stuck here, right? They have they kind of like walk like this and they have like no mobility here. If I'm teaching them to improve this mobility, and all of a sudden somebody knocks them, now they have mobility. If they're stuck here and somebody knocks them, where are they going to go? Over, right? If I'm trying to walk and I don't have the ability to move through my rib cage, I'm going to start to compensate because I don't have this fluid mobility. So when we even think about balance, like I just told you, if my client is very stiff and rigid here and somebody bumps them, they don't have the ability to do this and come back because they're so rigid. But if I give them that mobility, then they're not going to just.
Did we lose Jenice? Jenice, are you there?
She's out of breath.
I was going to say 2:45. She was like, I'm done. Jenice. Oh, she's just getting good too. We'll give her a second to pop on. You message her. All right, we might have been cut off, but you all have her contact information. She's so receptive. I posted the, oh, there she is. Okay, you're there. Go, go, go. You were falling over. But you're muted.
You're
now.
also muted.
You have to unmute. Huh?
Okay. Yes. Remember, we want to make, if we can create that mobility, now they have that reaction time if somebody tries to bump them. If they're walking, we want to get them that more fluidity. Also, when your clients compensate, and a lot of you felt this, when we get you breathing better, you let go of that tightness, right? If your client has tight hips and they're trying to walk, it's going to be really hard to balance. If you give them that freedom of movement in their hips, now again, they have that flexibility to be able to walk more smoothly and avoid when somebody bumps them in a crowd, or they need to step down on and they miss a step. Now they have that flexibility and that mobility to adjust to those things.
Okay, I'm going to hijack like 2 more minutes because I think this is a really great one. And actually, while do you mind pulling up your contact info again? So it's right there. What about bracing? So as fitness professionals, we talk a lot, right? We've been told, you know, brace, cold, core. You know, talk a little bit about just the context that you've spoken about breathing today.
Yep. I want to kind of show this and then I'll put my stuff back up there. Okay. So one of the things we want to think about, why do we brace? Right?
To protect your spine.
To protect your spine, yes. But, and that's okay, but do you need to protect your spine? Because lots of times people are like, oh, I was told if I bend over, I'm supposed to brace. Why? You're just bending over. You don't need all that muscular effort just to bend over. But if you're gonna lift a 50-pound weight, or your 50-pound child, or your 50-pound bag of groceries, yeah, you probably gonna need a little bracing. The challenge is if you teach your clients to brace, 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 so your whole session, how do they leave your session?
Braced.
Tight.
Tight. Yeah. So you need to get them to be able to go from I'm lifting something heavy and I need to brace to I'm just walking. I don't need to brace anymore. You need to help them be able to move between those two things because they're totally different movement strategies. Does that make sense?
It's great.
Yeah, I think that's the hard one to teach.
Yep, it is. It is. But that's why you have to teach them low-level exercises as part of your programs so that they understand the difference.
So like that squat and those movements you took us through. So that was, again, one of the questions was the breathing was actually opposite of what we've been told as fitness professionals, exhale on the exertion.
On the
right?
exertion, right?
Right. Talk about like, is that retraining those low level?
Yep. So again, remember, I did say this, that's more of a corrective breath. So if I want my client to start to release, right, I can use this as my warm up, exhale and release and go into your squat to create that range of motion, right? But if I'm gonna have my client lift something heavy, I'm gonna have them go through more of a bracing type strategy. But it's getting them to not do that, not to leave your session like that, especially if you have clients who have injury, accidents, surgeries, things like that, because they will live in that tightness all the time until you help them not.
Such a great
opportunity.
opportunity.
I think, yeah, I'm sorry. I think also the awareness, the discovery, I guess is what you call it, making them aware that there are options. There are different ways to live, breathe, brace, and move.
Yes. Yep.
Yeah, I think that's a powerful takeaway that came up a lot was we don't always have to brace and hold our bellies in and you know, it becomes then, you know, almost, you know, automatic and breaking those habits with some of those strategies. How many times a day how do you integrate or ask your clients, somebody asked to do the breathing exercises? Yep.
The easiest way to get your clients to do it is make it the most convenient time when they go to bed at night and before they get out of bed at night.
Okay. That's great.
So again, remember I said you can teach this in supine, in just hook line with feet flat, knees bent. You can teach it with your clients with their feet up on the wall, knees bent 90-90. You can teach it in a prone position on their bellies, which for some people, if you have clients with low back pain, that might be the best approach, is if they're prone on their bellies. So you can teach it all different ways, but my clients will say to me, I have all my stuff next to my bed. I do everything from my bed. So it's a nice way for them to go to sleep at night. And it's a really nice way for them to wake up and have energy in the morning.
Perfect. Jenice, thank you as always. Here's her information. You guys have her handouts. Thank you. Thank you. I hope everybody enjoyed this session. Everybody stuck around. You had a great turnout. So if you're watching live, thank you for being here. Thank you, Jenice. Enjoy the rest of the bit remaining of the conference.
Awesome. Thank you guys. Thank you so much for joining me. Have a wonderful day.
I couldn't get her email.
What do you need?
It was too small. Oh,
the email, I think.
Yep. Jenice.
yeah.
Yep.
I need the email because it's too small on my computer. I couldn't read it.
Jenice, Jenice at fitnesseducationseminars.com.
Thank you.
Awesome. Thank you guys. Bye-bye.
Take care, everybody.
Bye.